Have you ever really stopped to think about what happens during a doctor's visit? I mean, on the surface, it seems pretty simple, right? You talk, they listen, there's an exam, and you walk out with a plan. But underneath all that, there's this incredibly structured, deeply human interaction going on. It's almost like a ritual. So let's dive in and really unpack the blueprint of the clinical encounter.
This quote from Dr. Abraham Verghese it nails it, doesn't it? It perfectly captures the profound trust that's at the very heart of this whole thing. It's so much more than an appointment. It's a genuine act of vulnerability. And the entire process we're about to walk through is designed to be worthy of that trust.
You know, what's really fascinating is that every single encounter has these two parallel stories running at the same time. On one side, you've got the disease. That's the clinician's technical framework. With a sore throat, they're thinking, okay, is this bacterial, viral, what's the protocol? But on the other side, there's the illness, and that's your experience. You're not just a sore throat, you're worried about missing work, or maybe you're thinking about your uncle who had something similar and it turned out to be serious. A truly successful visit has to find a way to bridge those two worlds.
All right, so here's our roadmap for this explainer. We're going to start with that core dynamic, then walk through the 5 key steps of any visit. We'll see how a clinician builds your story, turns clues into a plan, touch on the unseen forces that can shape the visit, and wrap it all up with the foundation of trust that holds the whole thing together.
So yeah, that fundamental difference we just talked about between the clinical view of a disease and your personal experience of an illness, that's the key to everything. Getting that dynamic right is what turns a basic checkup into real patient-centered care.
So how do clinicians actually navigate all this complexity? Well, it's not random. There's a well-defined structure, a 5-step blueprint that helps make sure nothing important gets missed.
And this chart is a fantastic illustration of that structure. It's a model called the Calgary-Cambridge Guides. You can see the process flows from top to bottom. But look at the sides. 2 things are happening the whole time: providing structure and building the relationship. They aren't separate steps. They're woven together through the entire visit.
And here they are, the 5 steps that really form the backbone of the encounter: initiating, gathering information, the physical exam, explanation and planning, and finally, closing the session. Now, every step is crucial, but the real detective work, the absolute heart of the process, that happens when the clinician starts gathering information.
This gathering information stage is where the magic really happens. It's way more than just asking a list of questions. It's about being a kind of detective, but a detective whose most important tool is empathy. And to keep all those clues organized, clinicians use a very specific tool. And that tool is the SOAP note. It's an acronym, and it stands for Subjective, Objective, Assessment, and Plan. You can think of it as the universal language for documenting a patient's story, and it makes sure every single person on the healthcare team is on the exact same page.
The S is for subjective. This is your story. It's where your personal experience of the illness gets captured. It's everything you tell the clinician. The clinician's job here is just to listen, to follow your lead, and to try their best not to interrupt, which, get this, is way harder than it sounds. Studies have actually shown that clinicians, on average, interrupt their patients within just 18 seconds. Right, so it's one thing to hear somebody say, I have a sore throat, but it's a whole other thing to understand what that sore throat means to that person. How do they actually get to that deeper level of understanding?
Well, they use specific tools for that too, like this mnemonic, FIFE. It's a really simple but powerful way to bridge that gap between disease and illness. By asking about your feelings, your ideas about what's going on, the effect on your function, and your expectations for the visit, the clinician can turn a simple symptom into a story with real, personal context.
And you know, when you start having those deeper conversations, emotions often come up. So there's another framework for responding with empathy. It's the NURSE mnemonic, and it gives a direct path to making a connection. It guides the clinician to name the emotion, show they understand, respect the patient's struggle, offer support, and then explore the feeling a little more. It's a pretty powerful script for building that essential trust.
So, once the clinician has gathered the subjective story and all the emotional context, how do they combine all of that with the hard data to actually form a diagnosis and, a plan?
This brings us to the O for objective. This is pure data. It's your vital signs, what the clinician finds on the physical exam, your lab results, basically anything they can see, hear, or measure. There's no story here, just the facts. And this is where it all comes together. The clinician combines the S, your subjective story, with the O, the objective facts, to create the A, the assessment. So for example, a patient's story of a sore throat plus the objective finding of white spots on their tonsils leads to an assessment of, say, strep throat. And that assessment then leads directly to the P, the plan.
in this case prescribing an antibiotic and talking about supportive care.
But that plan isn't a set of commands handed down from on high. The absolute best care involves shared decision-making. The clinician presents the options, explores what your preferences are, and you both move forward to a decision together. That, right there, is truly the pinnacle of patient-centered care.
Now, of course, the encounter doesn't happen in a vacuum. There are these powerful, often invisible forces completely outside the exam room that absolutely shape what happens inside of it.
Take a look at this. These are the social determinants of health. Things like your economic stability, the neighborhood you live in, your education, your social life, all of these things have a massive influence on your health, sometimes even more than your own genetics. A great clinician understands they're not just treating a person, but a person living within a very complex world.
And when that connection breaks down, when these factors aren't considered, the impact is real. I want you to think about this number, 33%. Studies have shown that a third of patients report having negative healthcare experiences, times when they felt their perspective just wasn't fully understood or respected. And that kind of gap can lead to bad outcomes and a serious breakdown of trust.
So, what's the antidote to that kind of communication gap? It's a concept called cultural humility. Now, this is not about memorizing a list of facts about different groups of people. It's a commitment to self-reflection, to understanding the limits of your own perspective, and to approaching every single patient as an individual, as the expert on their own life and their own experience. It's really about curiosity over assumption.
And that brings us full circle, right back to where we started, that foundation of trust. And that trust, it isn't just a warm, fuzzy feeling. It's built on a solid, ethical bedrock.
These are the core principles that guide every single decision in a clinical encounter. Non-maleficence. First, do no harm. Beneficence. Always act for the patient's good. Respect for autonomy. Your choices are your own. And of course, confidentiality and justice. These aren't just abstract ideas. They are the literal rules of engagement for a relationship built on profound trust.
And all this leaves us with a pretty big final thought. As technology and AI start to enter the exam room more and more, how do we make sure we protect and even strengthen this deeply human ritual? How do we ensure that our skills, both the technical ones and the human ones, remain worthy of that incredible trust?